Okay, so we are really excited to be here today and talk about this project that we did in Paraguay over the summer. I'm Rachel, this is Julia, and we just want to recognize our faculty that worked with us, Sherry Palmer, Shelly Reed, and Sandra Heaston, and then with the support of several other students, including Kaylee Hodgson, who is a statistics grad student. Okay, so this is just a group photo of us. The only person not in this photo is Shelly, but she's right here in the front row, so you can look at her. This is at Iguazu Falls. It's just a little trip that we took while we were in Paraguay. One of the amazing things that we did. Iguazu means big water, so it's very accurate. Okay, so our objectives of the presentation. We just want to share with you the aim of our research, including our research questions and the data that we compared about teenage pregnancy between Paraguay and other countries in South America. And that you can understand more about the non-governmental organizations that we worked with, including Fundación Paraguaya and Days for Girls, which some of you may be familiar with Days for Girls. So we will jump right in. So our two research questions were, what is the actual frequency of teenage pregnancy in rural communities, and what are the risk factors leading to it? And what possible solutions to reduce teenage pregnancy? What are possible solutions to reduce teenage pregnancy? So this project began over a year ago now. I met Sherry at an ORCA meeting through the College of Nursing, and we bonded over the fact that we both served missions in Paraguay. And I had no good ideas about research, but I did feel a lot about the public health needs of Paraguay, and so I shared those concerns with her, and she had already been in touch with Fundación Paraguaya, and they were wanting us to look into the teenage pregnancy statistics in rural communities, and so it was perfect. It worked out really well. And then Sherry worked to assemble a team of people that were interested also in the research. So a little bit of background here. Like I said, the leaders of Fundación Paraguaya were curious to know if the statistics for teenage pregnancy in rural communities were the same as in urban communities. There's a little bit of data describing the teenage pregnancy statistics in urban communities, but very little among the indigenous tribes that exist in Paraguay. So we did some research about other countries to find out potential risk factors for teenage pregnancy. Here you can read there's early sexual debut is an important risk factor for teenage pregnancy, parents being absent from the home, a low economic status, barriers to getting contraception to use, living with a boyfriend, and poor parent-daughter communication were all risk factors that we discovered before going to Paraguay. So one study was done in Asunción in 2012 in a very urban area of Asunción that discovered similar risk factors to those that I just explained. But in addition, failure to attend school was an important risk factor. Poor use of contraception rather than the barrier to getting contraception, and the lack of sexual and reproductive education were all important in Paraguay in this urban area. So we set out to see if that's the same in the rural areas. So just for comparison, in South America, as well as some comparative data for the United States and Canada, Paraguay has the third highest rate of adolescent pregnancy, with 57 out of every 1,000 girls from ages 15 to 19. So that's very high, especially comparing with the United States and Canada. But it was interesting as we began to talk with community leaders and teachers and people that were constantly with this population in Paraguay, in the rural communities. They predicted that 7 out of 10 or 8 out of 10 girls would be pregnant before the age of 18. So that statistic is much higher than what we're seeing here in this graph. Okay, so just a little bit of background information about the non-governmental organization that we worked with, Fundación Paraguaya. It was founded in 1985 by local people that saw that there were issues that needed to be solved, but it has grown since 1985 to include 450 staff members in 28 offices throughout the country. Their main objectives, their main programs focus on microcredit, so giving small loans to small business owners, entrepreneurial education for young people and young adults, self-sustainable farming high school programs, so boarding schools where the kids learn practical skills, and Teach a Man to Fish, which is actually a separate non-governmental organization in London that works to spread the self-sustainable high school program throughout the world. One of the most interesting programs that we learned about that they use is called the Poverty Stoplight. So that's that photo you can see with the 3 different levels of poverty. They give a piece of paper to families in these rural areas with 50 indicators for poverty that include information about their water source, their food sources, the type of home that they live in, and other resources that they may have. And as they rank themselves, they're able to see where they need to improve. And the Poverty Stoplight gives them ideas of things that they can do themselves to improve their situation, to be able to come out of poverty. So Poverty Stoplight really looks to develop and implement useful, practical solutions and to solve the poverty problem in Paraguay. So this is one of the schools, the self-sustainable high schools. Half of the population in Paraguay lives in poverty. So it's very important, lives in rural areas. So it's very important that these students can learn how to farm, how to take care of animals, and how to produce their own resources for where they live. These are just some photos from this school in Cerrito, where we stayed and did a lot of our work of the students. That's their garden and some of the animals that they take care of, and they spend 1 week in class, and the next week they go out into the fields and they work. So it's an interesting program that helps them to have practical skills to be able to move on into the real world afterwards. There is also on the same plot of land a hotel where we did stay, and it was really nice. And the students that go to the Cerrito school work at the hotel as well. So they learn skills of how to work in an office, how to do customer service, how to organize events, and they also work in the cafeteria, so how to cook and things like that. It was really, really nice. And they have an area in the hotel where local artisans can come and sell their handicrafts. That's one of the main sources of work in this area for people, is making handicrafts and then trying to sell them to visitors. So it's interesting to see some of the initiatives that they already had going on. So we came and we observed all of this, and then we began to do our study. It's a qualitative descriptive study. So we used a questionnaire with 4 main questions that Julia will talk about a little bit more just in a moment. And then we had some backup questions just in case, but we try to let the interviewee lead the discussion and tell us what they wanted us to know about teenage pregnancy in their area and the things that they felt were risk factors and also possible solutions to teenage pregnancy. So we used a convenient sample. We were fortunate that we were able to do Days for Girls while we were in Paraguay. It helped us get into the schools. They were happy to have us come and teach, and because we were there, we were able to talk with the teachers, the principals, and the community leaders while in the school. And then we would also take references from each person we interviewed to find out who else we could talk to. So about 6 months before we went on the trip, I, with Sherry, began writing the IRB, which is the ethics approval, and I learned a lot about writing IRBs and how to phrase everything and how to rewrite it a couple times so that we could get it passed off. That was a really good experience to learn, and then it was helpful because the leaders of the Fundación Paraguaya were willing to look over our questions and make sure that they were culturally appropriate, that they were written correctly in Spanish, because all the interviews would be done in Spanish. So just as an example, Paraguay is a little bit special. Spanish is the official language of Paraguay, but Guarani is also the official language of Paraguay. So many of you probably know Spanish. Pregnant girl in Spanish is chica embarazada, and pregnant girl in Guarani is cuñataí uasuva. So we don't know Guarani. But we were lucky to have translators that helped us to be able to communicate effectively with people that understood Guarani better.
Okay, so how we did the interviews was we would go to these community leaders. The Fundación Paraguaya actually kind of set up our interviews, and they were connected with these different community leaders or different teachers or anyone that they thought would be interested or would know something on the subject. And they set us up with an interview with them, and we would go to them, go to the school or the office where they worked, and we would ask them these 4 questions, and maybe others if we felt so inclined. But the 4 questions that we asked were, 1, what is the frequency of adolescent pregnancy in this region? And that's where they gave us the information, out of 10 girls, how many would get pregnant before 18. And a lot of them, just like Rachel was saying, said around 70, some it depended on their background, but we'll go into that later. The second question was, what are the risk factors that contribute to teenage pregnancy? Kind of getting an idea of the cultural aspect of this. What are some things that are happening in this region and in Paraguay that help reduce the incidence of teenage pregnancy? Is there anything happening already? And number 4, what do you think are some solutions to reduce teenage pregnancy? And we'll go over some of the things that they talked to us about. Some of our observations, just as we were in Paraguay, we started in a big city in Asunción, which is very urban. A lot of city, a lot of buses, a lot of cars, but right as we crossed the river, it became super rural. Just as you see in the picture down here, just wooden houses or maybe brick houses with these tin roofs. And they, some of them had governmental help, and there were very few of those just brick houses. Their water source was most likely a river that passed by, but it didn't have any filtration on it. So if anything got into the water source, they wouldn't have a way to help themselves from disease. Their food, most of these communities we found out were kind of from all over Paraguay, and they were kind of kicked out from where they were from, kind of like these traveling, they weren't originally traveling groups.
They were like relocated.
Yeah, they were relocated. And so now they're in this community, and they have these community leaders. So originally, they went and hunted and gathered to get food as their like ancestry. But nowadays, since they're closer to urban civilization, they go to tiendas, which they have prepackaged food or a lot of rice and chicken that they eat, and that's their main food source. Although some of them still practice herbology and medicines like that. We'll go into that a little bit. And their clothing was very secondhand, and their work was mainly, they had to travel to get there, to the big city in Asunción, which is about an hour or two away, or they would go even farther into the rural area. Rural, because it's semi-closest to the big city, but even farther out, there's hardly any schools. So these kids would stay at the education that they had, which is why it's important. And we talked about the maturation when we did. So we talked about Days for Girls. This is a group that was founded in Kenya, and it was just talking about maturation to teenage girls and helping them be comfortable with this. And all of us that went on to this Paraguay research did an online course to know how to teach this, to know how to address this, and to be sensitive about it. But essentially, we would get into groups and invite all these girls together above the ages of 8, and we would talk about feminine hygiene and about maturation and about menstrual cycle and even fertilization and anatomy of the male and the female, very briefly, and just introduce them to this idea, because we found a lot that these girls are affected a lot by how much they know. One of the factors that we talked about to the risk for teenage pregnancy was that they had very little sexual education, so they didn't know what it was or what to be careful of, and their parents weren't really talking to them. Mothers weren't comfortable talking to their daughters about maturation because something like teenage pregnancy might have happened to that generation, and so moms didn't know how to address it. And so they were worried if they did address it that they would encourage teenage pregnancy. So it was this whole stigma. So hopefully by talking about these things, it would help with that. In our course, we explained this kit, which has reusable feminine hygiene pads, and we taught them how to clean it, and it's made out of cloth, so it should last for a long time. And although most of the girls did have access to disposable pads, we talked about the cost benefit of using these and the importance of hygiene. So they could choose to use these or not, but as long as they knew about hygiene and about all of this and being comfortable with their own bodies, and especially self-esteem. We talked about sexual education, but also self-defense and human trafficking, so that they could be generally aware of it, because they are younger girls, 8 to maybe 18, depending on the group. And at the end, we would talk about how important it was that they knew that they were important, that they were part of a community, and that whatever happened to them, if they did get into a situation where they needed to use self-defense, that they would survive during the incident and after the incident, and that their community could help them. And so by talking about this openly, we hope to introduce this very natural conversation so that they could talk with their family or talk with their teachers or whoever it may be. So over here on the left is a school where it was actually funny how we were talking to them in Spanish, right? All of these, we speak English, but also spoke Spanish to them. But it turned out that they didn't understand Spanish that well. So we had a translator whose name was Alicia, and she was translating Spanish to Guarani. And then we found out halfway through that they didn't understand Guarani that much. So there was another translator that was their teacher that translated Guarani to Com, a community language. So there were 4 languages being spoken, just for them to understand this basic concept that we were talking about. And so you see how this is a big factor in a lot of girls not being able to get the sexual education or even any education because they don't understand the language, because they come from these other communities. At the bottom is one of the biggest Days for Girls classes that we did. There were about 50 girls there. And on the far right was the first one that we did with a comm community, and we hope that they understood the Spanish that we were speaking because they were very quiet. Because a lot of it is taboo, and so us talking about this, they get scared about it. So then the data that we collected, we recorded all the interviews. So going back to the interviews, the Days for Girls and the interviews are kind of separate. The interviews that we did were recorded, and now we're in the process of translating and transcribing them. And we're going to analyze the data, and as it continues, we'll find the themes that keep recurring from the interviews. And some of the preliminary results for the risk factors of pregnancy include going to parties. These girls, when we asked these interviewees what a girl looked like that had risk of being getting pregnant at an early age, she would go to parties. Her parents wouldn't supervise her that much. They would use drugs and alcohol. Prostitution was actually mentioned a couple times, and some of these girls, since there's no job opportunities over there, would use the prostitution to get money for something like cell phones, or even maybe their parents would encourage it so that they could get money for their family. Because if they had a child, then the father of the child had to attribute some money for the child's well-being, even though he may be far away. And so some of this was drew our attention. The second main risk was they wouldn't go to school, and their influences, they would have a peer group that just wouldn't go to school with them, or they didn't have things to do outside of school, so they were bored in the middle of a field with a big sky and lots of grass, and what do you do there? And so there were very, very many activities. And another one was the cultural acceptance of teenage pregnancy. Just like we said, that maybe about 70%, at least from the reported interviews, 70% of these girls were getting pregnant before 18, so it was almost normal. Multiple generations had this routine, had this habit of getting pregnant early. And a lot of them, you could talk to people that saw it as something that needed to be changed, or something that was just a norm, that was hard. And a lot of these girls their parents were absent. Like we talked about, the work availability was far away, so the parents had to leave, and many times they would leave for a week and only come home for the weekends. And so these kids are left home without the parents. And once again, what do you do with the big open sky and lots of grass? So then we talked about the interventions. We asked the the interviewees, what could we do? As a lot of them, most of them talked about reproductive education, teaching the girls what this is, and they loved the idea of Days for Girls. Fundación Paraguaya actually talked to us more about getting a group situated down there, or like teaching people down there that could teach themselves, right? And to encourage school attendance. Fundación Paraguaya has this unique approach where they have like this boarding school type thing, where they invite kids from all over Paraguay to come live at the facility, and they're closely watched so that they can learn more about these things. And increasing organized activities out of school will keep them busy and will encourage them to be social and to have all these activities. And increased work activities will help. And another one was to increase communication between the teens and their parents. That family bond will help them in the long run. And so, in the end, when we find all these results, we will share them, and then we'll plan on how we're going to move forward. So this is kind of the first stage. We hope to go on to a phase 2, which could include interviewing maybe the teenagers, or it could include going and adding an intervention of the ones that they mentioned. But these are the basic results that we were finding. We're still in the process of solidifying all the data, of analyzing all the data. And that is our research. Are there any questions?
We don't have a lot of time for questions, but if there are any, please go ahead. Okay.